Hello everyone. My name is Małgorzata Reiter, and I work at the Institute of Philosophy and Sociology of the Polish Academy of Sciences, where I'm an associate professor. I also had the Rare Disease Social Science Research Center that we established as a part of the grant in autumn 2019. And more or less at that time, or rather 2020, we started organizing seminars on society and technologies on health and illness. And more recently, I started collaborating with Eva Maria Noll from the Institute for Social Anthropology of the Austrian Academy of Sciences on the topic of rare diseases. And shortly before, Eva was talking how our collaboration started. And currently we have this project on transitioning rare diseases. And this lecture is a kind of both for the society and technology and health and illness and transition in rare diseases, because I'm sure we'll talk about all these issues. And now, Eva, could you introduce our speaker today?
Yeah. Thanks, Koja. Welcome, everybody, to today's lecture. Today, we will look into rare diseases in Austria, so a special national context, and we have the absolutely expert for this topic today with us, medical doctor Ursula Unterberger. Ursula, thank you so much for being with us. You work for Orphanet and for the Medical University in Vienna. You spent several years in the United States working especially on prion diseases, and I know you for a long time with your special interest in rare diseases. You then worked for the National Coordination Center, or the National Office for Rare Diseases, on behalf of the Austrian Ministry for Health from 2011 to 2019. And now you are responsible for a number of projects. First of all, you are responsible for the work package 7, objective 2 on the undiagnosed diseases in the framework of the European Joint Action on the integration of the European reference networks, the ERNs, and I'm sure we will hear a lot about them today. I'm very happy that you summarize it, how this rare disease landscape developed in Austria over time. And yeah, I hope to learn a lot today. I'm sure I will. And yeah, I'm looking forward for our discussion afterwards. We will have now the presentation. And please, in the audience, if you have questions, Ursula asked us to interrupt, but you can also take notes or use the chat function if you have an immediate response or question. Ursula, the floor is all yours. Thank you so much for coming.
Thank you for the kind introduction, Eva, and thank you for having me. I'm glad people are interested. So I'm sharing my screen now. It worked nicely before. Do you see it in full screen mode? No, right? Now. Full screen mode, perfect. So, yes, I'm really happy to give you this overview, because when I thought about the presentation, I noticed how many years have gone by, and how this, how and when and where this journey started. And so I would like to give you a timeline of what happened in the past more than 20 years. So for me, I got in touch with the term rare diseases first when the partnership in Orphanet was offered to me and my colleague Till Vogtländer, also from the Medical University. So he was at a meeting in Paris, and the leader of Orphanet then asked, do you want to participate in this EU project? And that's how I heard rare diseases, like diseases that affect no more people than 1 in 2,000. And I found this completely exciting, and because it's a smart idea, if you think of it, to not just fight for your disease, but fight for diseases. There, one disease might not affect a lot of patients, but if you take them together, you have some political weight, and the problems and obstacles that patients encounter are surprisingly similar to each other when you compare it to the heterogeneity that is among rare diseases. So yes, we took over Orphanet. It had already started here in Austria in 2002, but nothing really happened. So it switched in 2004 to us, to the Medical University of Vienna. And just to let you know a bit how Orphanet works, it was founded in 1997 in Paris, first as a mere database and web portal. So the French Ministry of Health thought, okay, we have rare diseases. The French are always very progressive, much more than people here, unfortunately, for us. And they said, okay, those resources for those rare disease patients, they are so scattered and hard to find. We need some kind of database where we make this information available to the public. And so Orphanet was founded. And first it was just a list of rare diseases, and it was constantly growing. But with the years, it evolved into a classification for rare diseases. So it's really like an arborization, like a tree, where you have groups of diseases and you have diseases and you have subtypes of diseases. So all that wasn't there at the beginning. That was about 2007 when Orphanet really could be called a classification. Today, as of July 2024, there are over 6,000 rare diseases. That does not include the subtypes or groups of disorders. So there's about something more than 9,000 entities in this database, covering all medical fields. And it's still growing and growing, and new diseases are being discovered, but Orphanet is also just incomplete because, like I said, it just started as a list. There are duplicates and there are diseases missing. And we are still always glad if someone tells us about something that is amiss. But on the other hand, I have to say it's not, I mean, it's a well-known project, but it's not a big project. So it's just a few people working on this scientific classification. It's like 5 people, I think. I did it too for a while from remote in Austria because they were understaffed and they always need support. There are 40 partnering countries all over the world. But it has to be said that what these institutions do is mainly propagate Orphanet and serve as contacts for Orphanet. And they also, especially the ones in Europe, collect data on this, what we call the expert resource database. That is the addresses of experts of clinical experts, of diagnostic experts, of research projects, and so on. So it's very different what the partnering countries do, but it's known all over the world. It is funded mainly by INSERM in France, in Paris, and also by EU money. So in principle, the project belongs to INSERM, but there is always EU projects. Unfortunately, we always have to apply for a new grant, which means kind of some innovations. So we are not an infrastructure that just receives money from the EU, but we always have to present the EU with something new that we think of, and that makes it really hard. That's really an issue when funding such projects. Same as for the European reference networks. The current EU grant is OD4RD2, and what we did here was establish nomenclature hubs. This is a local team in member states that supports experts and officials in the implementation and use of ORPHA codes. So ORPHA codes are, like I said, Orphanet is a classification and nomenclature, and every disease has a unique number that is assigned to it by default. And these are used as ORPHA codes like ICD-10 of the WHO. And now a lot of countries are in the process of implementing that. And of course, it's not easy to implement a new classification in health information systems and in electronic health records, as we are all striving towards a common European health data space. But it's very important, but not easy. But at least in Europe, it is now recommended to use these ORPHA codes, and at least we do not have to really convince at least our government anymore. At the same time, Orphanet or the Orphanet leaders in France, they were also always open to take the Orphanet work a bit beyond its borders and not just do work for Orphanet directly. There were also at the beginning not so many resources that could be registered, so we had time to do other things. And that was great, because what we did was advocate for rare diseases in general. And like I said, the term was not well known. We had to explain it to everybody, not only clinicians and government officials and so on, but also the patients, because they were patient organizations were advocating for their own disease, but they were not sticking together. And the thought was, okay, if there is money, I will have it for my group, and so on. So we had two ideas. We had the idea for a national action plan for rare diseases, but also for a national patient umbrella organization that would harbor the patient organization for rare diseases under its roof. And as you can imagine, this again took a lot of time. So 4 years after we started working for Orphanet, we did a petition for a national action plan for rare diseases. It had become clear in the EU that national action plans would be something important, and in 2009, accordingly, a recommendation came from the European Council for a measure in the field of rare diseases, which also included the national plans. But Austria's officials always needed a little push and a little help. So the petition, a petition then was not what a petition is now. It wasn't done on the internet, and we weren't doing this online. We had sheets of paper which we laid out everywhere, and we stood in front of the general hospital and places to get people to sign. And eventually we handed, I don't know, 1,500 signatures to the Minister of Health here in Austria's largest hospital. And we were told, yes, we already know we should already have done something for rare diseases, but we haven't gotten around to it. And so it was successful because there was an impulse from the European Union. And then there was a little money for this project. Back then, I think it was 2 full-time equivalents, something like that. And while I was in the United States, my colleague and a co-worker of his started working on the cornerstones of this national action plan. There was a small commission on that, and the commission was consisted of a lot of renowned physicians in Austria, and of course some of them at least had to be really persuaded to agree to our plans and to see that this was necessary, because like I said, it hadn't been a topic here. And this took another 3 years. That was the time when I returned from the US and directly joined the team then here in Austria. And we started really actively working on this action plan now that it was clear what should be in such a plan and what would be the topics for this plan. At the same time, in 2011, ProRare Austria was founded. So this umbrella organization for rare diseases. So eventually the patient had come together and were able to found this organization, which was great because especially some of them had a lot of experience how to build up patient organizations. For example, DEBRA for butterfly children, that was extremely professional. And that helped a lot with this organization and how to run it. We then started with a survey on the situation of patients here in the country. And then in 2013, we finally started writing the plan. There was 3 of us again. In 2015, so 7 years later, the National Action Plan was published eventually. So here's a bit of an outline, what it means and how it worked. So the meaning of setting up these national plans all across Europe was to get some structure and some coherence into the landscape of rare diseases in member states, because if you have measures, you don't want them to be scattered and duplicated and so on. But you want to know about gaps. You want to build a structure where you can target certain issues. And what was important, that it was agreed upon by all stakeholders in the healthcare system. I mean, by all stakeholders, I just mean the ones that make the decisions, of course. So that's the Ministry of Health, that's the Social Security, the insurance companies, or not companies, but institutions, and the countries the counties in Austria. I never know how to call them. So the 9 regions. And eventually all ministries involved agreed as well. So it was the Ministry of Social Welfare, the Ministry of Health, and the Ministry of Science. So that was really tough. And I think it took a year to have this consensus process. And when everyone was happy about this, there were 9 fields of action with around 80 measures to all built around improving the situation of rare disease patients, like clinics of rare diseases, diagnostics, epidemiology, general knowledge. What else was there? Research, orphan drugs, of course, and I'm not sure. Yeah, I think building a national advisory body was also in there. The runtime was originally until 2018. In 2018, nothing really changed. It ended, but it was turned into a strategy and said, okay, it's now officially without end. Yeah, so that we didn't really know what that meant at that time. To me, it sometimes seemed that it was just so, okay, we just keep going and it's all really slow. But you will see that in more detail in a bit. Because within the first 3 or 4 years, something was achieved, but not that much. The main point was there was no funding. We were always told, okay, we can write things in there, but it cannot cost anything. The only thing that was funded by the Ministry of Health was for the coordination of measures. The thing is, of course, in Austria, we have these 3 institutions. So we have the decentralized healthcare systems as opposed to, for example, in France, where the Ministry of Health decides everything. Here, the ministry decides nothing really, but all these 3 stakeholders that I mentioned before have to agree. And of course, everyone says, well, I'm not paying if the others are not paying. There is a common pot, but it is not easy to get things into this common pot. So we are still fighting for that in a way. And there is a plan for this, and it has to decide it very early, like 5 or more years in advance. So if you are unlucky, as it happened for us with some measures, they tell you, okay, the next 5 years have already been planned, and then you can come back in a few years and we talk again. So the first thing we did in the frame of this rare disease national plan was officially designating or accrediting centers of expertise. That means clinical centers for rare diseases or a group of rare diseases each. And like I said, it was some kind of accreditation system. The work included, of course, setting up the whole process, the survey, and which was 70 pages long, for example, and it involves 2 external reviewers from German-speaking countries, but not Austria, and so on. And all the SOPs were developed in this context. And that we managed to have 2 designated centers of expertise when the European reference networks were launched in 2017. Maybe a word on the centers and on the European reference networks. So in Austria, it was concluded that the accreditation by the Ministry of Health would be a prerequisite to receive endorsement to apply as a full member for an ERN. So it was tight because the reference networks were launched and centers were complaining that they didn't have their accreditation process and they could not apply for endorsement, or they did not have the endorsement. But there was a second call and there were more accreditations. So now we have around 40 centers of expertise. I'm not quite sure because I never know which ones have really gone through the whole process. And we have to ask again. but it's around that number. We have 9 ERN full members, one of which is a coordinating center for rare pediatric cancer, so in PETCAN ERN. And this is not a lot, so other European countries have a lot more. I don't know how many, like Germany has, well, they have maybe 50 or 100. I'm not quite sure, but a lot more. So this was certainly an issue, and we were slow, and it was less than ideal, but we did not have more money. The other centers of expertise then managed to join the ERNs as associated national centers, which links us to at least each ERN with one center. So that's also an advantage because there is an entry point in Austria for each European reference networks. The ERNs are 24 networks in different medical fields. So they are covering a large proportion of diseases. There are just some gaps, like, for example, rare gynecology or dentistry or dental disorders, some gaps, but not a lot. Launched in 2017, but the process to get there had been a very long one. In the EU, basically this started with the Lisbon Treaty in 1997, because we had the free, what is it in English? So persons and goods could move freely within the EU, and but the healthcare systems are under local authority. So and that is really written in the treaty. And but the problem is, it was recognized that you cannot really divide these topics. You cannot say you have a free European trade system, but you're keeping medicine just inside the country. And that's when the discussion also came up that it would make sense to have comprehensive networks that comprised all the expertise from the best experts from all countries, and that's the way you should treat and you should deal with rare diseases, because in one country you will not have enough expertise, especially in small countries like Austria. So that was a decades-long process before the legal requirements and everything had been clarified and these networks could be started. They are partially funded by the EU, but still there is a lot of personal input from experts, mainly. At least in Austria, there is no additional funding for these centers of expertise, so they are doing a lot in their free time. And it depends very much on individual people and initiative. Yes, I mentioned that. This is a picture how we envisage the landscape in Europe with our centers. It did not or has not worked out yet like this. This is Austria. And here the little colored houses where it says B, those are the centers of expertise. We call them type B centers here. And they have their partners all across Europe. For example, the green one is coordinating and it has partners in all those green countries and so on. And we already have that. But what we do not have, you see this tiny A here, that this is the additional idea of having comprehensive centers of rare diseases, which consist in one university of several centers of expertise, and which have rare disease boards, for example, and have diagnostic boards, and are therefore an important prerequisite for the diagnosis of patients. And they are very important for very rare and undiagnosed diseases. And like I said, unfortunately, we still do not have those. A lot of countries have them in the meantime. But here, the type B centers, they are still not really organized in some way. So, and that also brings me to the summary of 10 years after the national plan was published. What we have fulfilled is the designation of these around 40 centers of expertise, including setting up the process and everything, and giving the endorsements and doing all the paperwork for the from the ministry side to endorse these centers. And what we've also done, and that was very much the work of Orphanet Austria, in working together with the General Hospital here, the largest hospital, and the clinicians from there. So we implemented orpha coding in hospital information systems. That was also a process that took more than 3 or even 4 years. So this really is complicated. It was postponed over and over again because there was no, it wasn't mandatory to do that, and therefore it wasn't working. And then the ministry made it mandatory for COEs beginning in January 26 to have orpha codes and to code with orpha codes. And then all of a sudden it goes very fast. So that even if clinicians were willing to code, it was hard. I mean, it costs maybe a few €1,000 to do some programming and stuff. But if it has no priority, it can take forever in those systems. And then we have a number. I mean, we have smaller measures fulfilled, like setting up a rare disease advisory board, for example. But this had already been present before the national plan was published, and also the umbrella organization, for example, was published, was constituted, and they receive a little funding, but it's really not a lot. So they have to receive funding from pharmaceutical companies, which is also less than ideal because then they are not independent enough. But we have lots of important measures that are still not fulfilled. For example, there was a prioritization exercise in 2021 among stakeholders, and they prioritized the National Undiagnosed Disease Program as among all measures of the national plan. We had a working group and we made a concept, but we were not lucky and were told to come back in a few years, because in this process where everyone pays into the basket, we did not make it in time, which is frustrating. So this was 4 years ago or 3 years ago that the concept was ready, and now it's just there in the drawer. The next thing is a registry for rare diseases that was also prioritized, but we haven't really done anything for that. We want comprehensive centers for rare diseases, like I said, also because they are very important for patients who are still looking for their diagnosis. And we also had a working group on designation of medical laboratories in analogy to the clinical centers. We also finalized the paper in this working group, I think, when was that? I think in 2017 or 18. And it's also still in the drawer because, because of some European developments that were delayed and accreditation was not necessary, and then Austria doesn't do anything. And this is why we need a lot of support from patients. That is, I don't know if patient representatives are listening, but the ministry is often impressed by patients. So they are more important than they might think. but we also need support by the European Union. So if things happen in the EU, then things happen here as well. And a good thing was that we are coordinating the Joint Action for Integration of ERNs into national healthcare systems, JARDIN. So we are coordinating this in here at the University of Vienna. The project started in 2024. And what is really important that the ERNs are kind of floating in midair or somehow in space. They were very important structures, but they are not really visible nationally, and they don't really have connections here. So it's hard to reach for patients and also physicians, and little knowledge is available in member states. And integrating them into the national healthcare systems, that will include a lot of the measures that we also had in the national plan, and it will add a lot of measures, of course. So the national plan should really be revised and include things that will come about with JARDIN. Some words on it, on this project. It's a 3-year project in the frame of EU for Health. That means it also includes Norway, because Norway pays into EU for Health as opposed to Switzerland. So our Swiss colleagues are not happy with that, but that's how it is. There are more than 18 million funding. 80% comes from the EU because we have all EU member states and Norway on board, and that means we get a lot of EU funding. And a smaller contributions from the member states is necessary. But in principle, those so-called joint actions are projects where the member states are reminded of their responsibility, and really the EU tries to get member states to contribute and also to pay and take measures in the country. And calls for such projects are if there is a topic of high public interest. So it's not for every topic. We have almost 60 partners from all member states and Norway. 60 partners is a lot, so that meant a lot of sleepless nights during the 1.5 years of application for this project. The project has 9 work packages, including a lot of topics that are not in our national plan, like national reference networks, which should support the European reference networks in the member states, patient pathways for rare diseases, but also for undiagnosed diseases, undiagnosed disease programs, governance of ERNs and centers participating in an ERN, reimbursement for the services of the ERN centers, and so on. And also, of course, data management. That's a huge work package. What JARDIN will produce are recommendations and implementable solutions. We cannot tell the member states to do anything. We can just give recommendations, where we can guide them, and then hope that member states will feel the push and try to follow the recommendations. And also, what the EU really wanted was pilot implementations in some fields, in some countries, to show that it is doable, it is sustainable, and then it can be done, and that some countries then can serve as examples for others. And like I said, here we are really putting our hopes into the EU to get us going. And we also need all the support we can get, first and foremost, of the patients. So that was it for me, and thank you for your attention.
Thank you.
Yeah, thank you so much. Goja, shall I moderate or will you?
You can go ahead.
Okay,
I don't know what we.
Yeah, thanks a lot, and thank you so much, and welcome those who joined us a little later. I'm sure there are a lot of questions, so I will open the floor since we are such a small, tiny group. Just please open your mics and your, if you like, also your video cameras, and let's simply give me a sign if you want to start with a question. Goja, why would you not start? I'm sure you have hundreds of questions.
I do have, like, actually, yeah, I do have a few questions, and I'm sorry if the questions I'm going to ask were already answered because I got frozen from and I had to restart. Yeah, so sorry. But one question actually applies to Ursula. First of all, thank you so much for this overview. And I think in some regard, it's, I know, it's a set perspective in a way to say that countries are and the approach to rare diseases may be similar across different countries, and the understanding of, that's why I said it's sad, because it goes pretty slowly, not only in Austria but in some other countries. And I talk here about Poland, but also Finland, where I did research, although Finland is much more advanced in many regards, such as registries and everything. But what I wanted to ask you is exactly the European reference network. And you said something that they are kind of floating in the air. And I like the expression because this is something that, drawing on that research I told you with the rare metabolic diseases here in Poland, that was my impression too. That we have definitely as an ERN in Krakow, but nobody really heard about it except for a few doctors. Patients have no really access, and it was astonishing because I thought, okay, we have this ERN in Krakow, but the population in that region in southern Poland is not really taken care for. So what's this, what do you think these ERNs should do, or what is the idea of combining them, what you try to do in the JARDIN project, with the national health systems? Because it's something that it's really needed, I feel like it. And also how to make the role more visible for the doctors and patients. Sorry, like many questions in one, but they are also connected.
Yeah.
So I would,
yeah. So what I really think is most important to have pathways in place where you go from the general practitioner, family doctor, to the highest level of ERNs or undiagnosed disease programs, and you hand over the patient, from one level to the next, to give everyone the chance to be diagnosed or treated at their best point of service. So the general practitioners should be included in a much and of course private practice also, but also smaller hospitals and so on, and outpatient clinics. They should be much more involved at a much earlier stage, of course. We also have measures in planning in JARDIN to do better dissemination of knowledge on ERNs. And there will really be a blueprint how to do a campaign for this. But I think it's not the only way to do that, but really give everyone their task in this chain of services. And that's why I have high hopes in patient pathways. For example, there will be a general patient pathway where that covers any patient that comes into a doctor's office. So I think that is really a very important thing, and And the other thing is to launch national reference networks that should mirror the ERNs on a national basis. Because the ERNs now have the problem, they have lots and lots of partnering centers, but you do not really get an overview anymore, or a lot of them are not really responding to requests and so on, because there was no very consequent designation process for the centers. That was just too expensive and somehow impossible. Countries were supposed to be doing that, but they did it in a very different way. Austria was very slow and very thorough, but then too late, and we don't have any members. Others were quick, but they don't know who the members are. So I think that's the other thing, because those national reference networks, I'm sorry, they should really include secondary and tertiary level of healthcare. So really I have to drink something, I'm sorry. Okay, hope it works now. They were really, in private practice, there should be really much more networking for private practice also there, and to include all the departments. For example, in pediatric surgery, we would have the core of the network. We would have the top centers, and we will have some ERN members, but then include the other wards and the other private doctors, to have really a network ready for those patients, as opposed to just having scattered services.
Thank you so much. And I like that you emphasize this networking part versus scattered services, because this is also my impression based on the research we've done, or the analysis, that, okay, depending also on your geographic location, access to the hospital, but some patients are well taken care of, while others are really, like, even with the same disease, don't have the access to the same, or may encounter on the really basic level prejudice or lack of knowledge, and have to
exactly.
So
it's also, for example, about clinical practice guidelines. So these guidelines are developed in the ERNs, but then they are not used, at least not everywhere in the member states. Because I can see it here in small hospitals, they just say, no, we've never done this, and we don't want to do this, and it stops there. And the networks would help us to really spread those guidelines to all the departments that we have. That, I think, is an important issue, and it's also something that the EU wants, because they say, okay, we are investing money in the development of resources, and then they are not being used. That's an expensive exercise then.
Definitely. Okay, thank you.
Yeah, so if I may continue here along this line, how is it, because I know some people from smaller institutions who say, well, it's additional work and it's not paid, so why shall I do it? So I know that you cannot change it, but do you have a vision how we might overcome that?
Again, I think with networking, because if they are really in a network with their colleagues, for example, outcome data will be shared automatically, or you have to explain to your colleagues why you are not doing this all of a sudden. At least that's how we hope it will work, because, like you said, we cannot tell them to. But there will be some group pressure I would think. If they are really sitting on a table, on a regular basis and see that the best centers do it like that, then they will be encouraged to do it as well. So that's the hope that we have. And then there was one thing, because you mentioned transition. Of course, these national networks would also foster transition, because you would have pediatric and adult centers in one network. Because now we do have some networks, but they are like learned societies, and for example for pediatrics or pediatric surgery, and then again they stay among themselves. But the networks should then really cover adults and children.
Okay, we got a question by Daniel Eddy. He said, "Thank you for the nice presentation and insights on rare diseases. I'm in a terribly noisy place, so I would rather write my question here. How do you envision the integration of Austria's specialized rare disease clinics with the European reference networks evolving in the next 5 years or so?" So I think he asked for a vision again. Particularly considering the Medical University of Vienna's coordination role in the JARDIN project. Thanks for the question.
Mm-hmm. So it's difficult to say how the vision is, because what we thought is there would be a call for new members much sooner, and our now designated centers could join as full members. But then on the other hand, the ERNs are growing bigger and bigger, and the question is, does it make sense for everyone to join as a full member? And is it not more important to lay the focus on the national networks and anchor them in the ERNs? And but we don't know if there will be a new call or really what the EU strategy will be here. So that's a bit hard to tell. It would also be important to know if they are willing to kick out centers. I haven't seen a lot of centers being kicked out of a network. And also some networks reported that up to 50% of their members are not responding to any kind of request or anything. So that's really difficult, I think, in this context. And also what we did not really take into account when having the vision of the ERNs was that you need a lot of centers to cover the whole field of expertise, and then it becomes hard to coordinate this center. So at the moment, we are having high hopes with the national networks, but we still do not quite know how this can be done. Should the network be a member of the ERN? Should the coordinating center of the national network be in the ERN and inform the others and so on? So all this we have to work out in JARDIN mainly to see how this can work. Our coordinating role, I don't really think it makes that much of a difference, because we are not involved in the act of endorsing centers or really pushing particular centers. We know we have the designated centers of expertise now, and in principle they all have the right to their endorsement, and they will get it if there is a call. Something that I hope will be funded, we still don't know, but in the 3rd year of JARDIN we would like to do some pilot networks, national networks, and that might be something interesting. Also for people in the general hospital. Of course, having worked in this hospital for many years, and I've also been in pediatrics here, I know the landscape of the centers we have here rather well. So that always serves as an example for us, of course, when we think of measures. But again, like I said, we cannot really directly do anything for the centers here. If that was the question, I'm not quite sure. Does that answer the question?
Eva, we can't hear
Yeah,
you.
you're still muted.
Oh, sorry, Daniel. Yeah, he responded already. Yes, thank you.
Yeah. Can I just have a short follow-up? Ursula, I don't know if there's a kind of data on that, but I was wondering whether any of the national plans for rare diseases within the EU has a clause or anything included about those national reference centers as a goal or as something they want to establish in the future, or maybe, yeah.
You mean the reference networks? Yeah.
Yeah,
Okay.
whether
Yeah.
there is
Yeah.
the national plans have something like that.
I would have to ask my colleague from Work Package 4 because she has really worked through all the national plans, translated and worked through them. So I'm not sure, but for example, certainly France has had networks for a long time, and it works very well for them, of course. They are still struggling a bit because they were so much ahead of the ERNs that they have their networks and they don't see why they should cooperate with ERNs because they are really very well functioning in the country. So they have the opposite problem that we have. So that's something. I don't know if Germany has anything. I think some countries have something, but most will not. And it will really be an issue in JARDIN to also to recommend governments to include measures in their national plans. Of course, we know it's a lot of patient paper. Paper is patient, we say. But it's better than not having it written down somewhere. But we in Austria, we certainly do not have them. We have an undiagnosed disease program in the plan, but that hasn't helped much either.
Thank
And
you.
I also saw in my work package that countries have, and so I'm working for the undiagnosed diseases, and a lot of countries have measures in their national plan and they don't have measures. The others have measures but don't have it in their plan. And others have both, but there's no connection between it. So the national plan is not always what makes us happy.
Thank you. Thank you.
How is it with because we often discuss that one of the problem is that rare diseases is not anchored in the medical curriculums. How is the national plan? Is there any goal to make it, mandatory in medical training that you have at least heard about rare diseases?
Yes, as far as I remember, it is written down somewhere that this should be improved. But the measures, the formulation is rather vague. So you have to make this operational, so to speak. Mm-hmm. So I don't think there is anything concrete now. I know that the colleagues from the Austrian Health Institute were in touch at least with the Learned Society, or not with the Medical Association, I think, to at least have it in their program, postgraduate. But I'm not aware that there is anything particular with the curriculum. I'm not sure how it should be anchored there. So that's also a question of again, dissemination of information, because the question is, should it be a separate topic, for example, because that's something you learn and then you forget it again.
Well,
or would it be more useful to emphasize the issue more in the different fields of expertise and of fields of medicine? I've never really dealt with that part myself, but it's also not so straightforward. It would be interesting to hear what you think, of course.
Yeah, it sounds a little bit like the same question we had when it came to the introduction of women's study and feminist study in the university, right? There was the discussion, shall we have a separate institute or unit, or should it not better be within each and every subject, within each and every discipline? And in Austria, we went for the later, with the result that you have no institution, that people specialized in women's liberation or women's medicine have no position. So I learned from my personal experience that you always have to look for a good establishment in the system. So I would say, no, make it a special subject, because then you also can discuss the difficulties of rare diseases, I think, more openly and point with the finger. And for example, I'm invited every year by a colleague. She runs a program for nurses. So she is teaching nursery, especially chronic diseases in nursing, with the with a hospital. And she invites me to give a 1-hour talk about rare diseases, so the blood disorders I'm working on. And it's just one, but at least they have heard about it, and are, get sensible for the topics. So I think that might be a goal, to make it as graspable as possible. And I think the other part of the question, how is it with the curriculum, would be how is it with patient organizations? So how to bring in all the people involved, so also the caregivers, the professional and the private caregivers. So how to do it.
Yeah, now that's a very interesting insight. Thank you so much, Eva, and I will pass it on in the advisory board. What you're saying is also interesting, because we need much more involvement of the social side, and because the medical side is comparatively well served, but these patients, they are still alone in the when looking for social security and support and so on, and that this is mainly done, I think, by patient organizations, but for most diseases we do not have patient organizations, so these people are completely left alone.
So perhaps we might continue this talk with you when Michael Schatter will come to Austria in September. So perhaps we have a coffee together to develop that further. Are there any more questions, comments, questions also from your side, Ursula? It's also fine.
Yes, I already asked you about your project. I have some idea now, and I would really appreciate, and it would be lovely if we could meet. Just let me know, please.
Absolutely, we will do that.
Yeah, great.
Yes, and agreed. And also, Ursula, if by any chance you have time on we still don't know the date, but there is a large medical anthropology conference going to take place in September, and we'll have a panel on transition. So we're happy, Eva. I hope once we have the dates, because we'll definitely invite you. You can, I'm sure you can attend. But I have, yeah, that sounds great. And otherwise, I'm happy to have coffee in Vienna always. So, so that's nice. I also wanted to, like Daniel asked about it, but I also would like to ask on a bit different level the question about the vision, or rather, how, from your perspective, would a global collaboration, or could a global collaboration look like, and how Orphanet can be involved in that? I know it's a huge topic, but we also, I asked this question because Eva and I contributed to that book on global health and anthropology, and we contributed a paper on rare diseases, global health, and anthropology. And I feel like it's like, okay, Europe is doing quite a lot, but then when we try to organize a workshop and wanted like some partners from so-called global south, it's not really easy. And we know there are people there, some countries do have, but then there isn't much dialogue in a way. And sometimes it looks like ideas that have been created in the global north basically get implemented in the global south without really too much reflection to that. So I was just wondering about your vision or like opinion about that.
I mean, there are some initiatives. For example, that there was this the Lancet Rare Disease International Commission that was founded just recently, and Anna Rath, who is the head of Orphanet, is a commissioner there. So, and that's really something global, to work on global recommendations and measures, not just European, because Europe is a lot different. It's also a lot different from the USA, for example. So that's one thing that comes to my mind. And then there is also the WHA resolution that was now adopted, I think, recently. But I have little insight into this, I have to say. We were so focused on the European level. I mean, I can maybe, what I know more about is the undiagnosed diseases, where it's difficult, of course, if you don't have genetic testing, for example, if you don't have advanced genetic testing available, then it's really hard. The question is also how much can the European reference networks, for example, do for patients from abroad, because we really do not want to exclude them. I mean, we as medical experts do not want to exclude them, because it's also important for us to learn. And rare diseases should be really something global. I mean, there's some diseases that occur in some countries, and we can learn a lot from them. I mean, I remember, Eva, when you were here with Talsifo, and I heard this for the first time, because so that was really revealing for me, because you have genetic disorders that are frequent. So that is not typically the case here. And that you have in some countries so much knowledge, and here you have none. So we should not dismiss what the global south has to offer on some diseases and emerging diseases. But I'm not really sure what is being done about this, I have to say. For me, it's something I'm interested in, but then we say, okay, we cannot do everything at once. But I would be very interested to to learn about initiatives on that or bring this perspective. Yeah, because in some respects we are the ones who have to learn. As diseases become more frequent here, we should really tackle that.
Thank you.
Yeah, and I think you still get my
yes,
my information, right?
Yeah.
So we have this presentation of our book project next on Saturday the 14th.
Okay.
Our Mom Has Sickle Cells book. So I hope I will send you separately an invitation.
Yeah, thank you so much. Yes.
Please
Great.
pass it on to your colleagues, and yeah, I'm sure we will stay in contact.
Yes, thank you. Great. Yeah, great.
If there is not another urgent question, I would hand over to you, Gosia, to also close the session, perhaps.
Yeah, thank you so much. So Daniel, it's your probably last chance to write anything in the chat if you want to. Thank you so much for joining us. And Ursula, thank you for your great presentation. I think it's really good always to get this kind of overview, and it was enlightening for me. So thank you again, and I look forward to continuing our discussions in Vienna.
Great.
And and for the future, we have been planning some more presentations, either specifically on transition, most likely, and or more broadly on those on rare diseases in general, and I will just keep you posted. And
thank you so much, and thank you again for having me. And thank you for listening.
Okay,
thank you.
Great.
Good afternoon.
Yes.
Thank
bye.
You, and have a nice afternoon. Bye bye.
Okay. Bye.
Bye, and see you tomorrow, Gosia.